It is very confusing to try to sort out which level of care someone would need for treatment of their eating disorder. There is a whole spectrum going from inpatient care all the way to outpatient care. And I think it would be best for the person's care provider to help them make that decision. The American Psychiatric Association has printed a guideline with 5 different levels of care and about 15 different properties or criterion that meet each level of care. The most intensive level of care is inpatient or a hospital setting. And generally someone who is, say, under 85% of their ideal body weight or has significant psychiatric conditions such as alcoholism or drug dependence or severely depressed and an eating disorder may need that level of care. The step down from that would be called residential. And generally this is someone who doesn't have many medical complications, but they need 24-hour supervision to prevent them from the behaviors of their eating disorder or to give them the additional support they would need for depression, anxiety, and that sort of thing. The other levels of care are all called outpatient. There's just regular outpatient, intensive outpatient, and day hospital. And those levels of care is where a patient goes home at night, but during the day they have some sort of supervision. A day treatment program, for example, may be 7 days a week, 5, 7, 8 hours a day. Oftentimes a patient with an eating disorder who's attending a day treatment program would be having 2 or 3 meals there during that time that are supervised, and naturally they would be getting a full complement of therapy. Outpatient would be just meeting with your primary care provider, your psychiatrist, your therapist for a one-on-one or group setting. And oftentimes this happens at the end of treatment, in more of a maintenance phase, or actually at the beginning of treatment. If someone just isn't sure what kind of treatment they would need, they would start by contacting either a primary care provider or a therapist.